welcome to Health Watch. This is a program powered by the British Virgin Islands Health Services Authority, focusing on all things healthcare across the territory. My name is Damian Grange, and I am your Marketing and Communications Manager here at the BVI Health Services Authority. And we are thankful that you're joining us for this episode of Health Watch. Today, we're going to focus on all things accreditation. And with me, we have in studio the chairman of the BVI Health Services Authority Board, Mr. Ron Potter. We have our interim acting chief executive officer, Dr. June Samuel. And we also have our director of quality, Ms. Rhonda Williams. Ladies and gentlemen, welcome to the program.
Well, thank you.
Thank you.
It's an honor to
Good
be
morning.
here.
Thank you for having us.
Yes.
Such a pleasure. I know it's difficult to get the chairman in this position, but we're happy that you are here because we want the community to have an idea of what it means to have this certification, DNV certification, from the perspective of the Board of Management. And so, Chairman, I'm going to jump straight to you to tell us about the plans that the board has for the organization and how does accreditation ties into that.
Thanks again, Damien. Good morning. Good morning, everybody. First of all, I want to thank you, Damien, for, again, this initiative in terms of informing the various audiences that the Health Services Authority have in terms of the work that we do here at the Health Services Authority. I also want to thank the acting Chief Executive Officer and Ms. Rhonda Williams, the Director of Quality, in terms of all the good work that they've been doing over the past years. Accreditation. And first of all, what does accreditation mean? More specifically, what does accreditation mean to me?
Yes.
And it sort of helps me in terms of my role in terms of sort of setting the agenda for the board in terms of, the direction in which you need to take. And accreditation for me really is a badge of honor in terms of quality. And I actually equate accreditation with quality.
Mm-hmm.
And what does, in terms of implemented quality across the organization, what does that mean? So I look at a number of target audiences when we think about quality or when we just think about the Health Services Authority, period. And my first target audience obviously is patients. Mm-hmm. And what does quality mean for patient? So that means when somebody steps in the door, any facility at the Health Services Authority, that means that they're expected to get a certain level of care.
Yes.
No matter where they are, whether they're in Virgin Gorda, no matter where they're in Ocean Dyke, or here at the Rotown compound. There's a certain level of care that they expect to get across any of the services that we provide, so whether it's dental, vision, audiology, surgery, or whatever care that they seek from the Health Services Authority, there's a minimum level of quality that is expected to be provided by any person, any of the wonderful team members that we have at the Health Services Authority. So that would be the first audience that I think about really in terms of the authority, in terms of quality, in terms of accreditation. And then the next audience, obviously, for me is the, again, employees.
Yeah.
I want to remind everybody that the Health Services Authority is the second largest employer in the Virgin Islands after the government,
Yes.
the government of the Virgin Islands itself. So we have 650, as I call them, wonderful team members, and they have chosen to have a career to provide their services to the Health Services Authority. And what the accreditation says, it actually validates what they've been doing. It validates the choice that they have made in order to serve at the Health Services Authority, in order to have their career at the Health Services Authority, in terms of getting up every morning, coming to the Health Service Authority from 9 to 5. Hopefully, those are the hours.
It's 24 hours
24
actually.
hours. 24 hours.
24 hours a
Well,
day.
thank you for correcting me. Again, that just demonstrates the quality that we have here at the Health Service Authority. And so, for the hours that they put in every day at the Health Service Authority, their work is validated by having this accreditation, which says that we provide a certain level of quality each and every day. 24 hours a day, 7 hours a week, 52 weeks a year, however long that we've been doing it. And I also need to remind is that we've been doing this for the last 100 years as well, because we're into the 100th year of providing healthcare within the Virgin Islands. And to say that after 100 years of provided healthcare services, that we do it at this particular level, that we have been able to be awarded a badge of honor through this accreditation certificate. Not only that, we I think we're the only accredited healthcare provider within the Virgin Islands,
Within the region, yes.
and we've gone even further
English-speaking Caribbean for sure.
within the region. But very importantly for me, it's within the Virgin Islands. So in terms from a competitive perspective, in terms of if you want quality care, there's only one organization that a patient will look towards. And then two, in terms of if you want a rewarding career in an accredited body, again, there's only one institution that you can look to,
Right.
and that's the Health Service Authority. The other audience that I look at is actually the communities in which we have our healthcare facilities. So whether it's Yost Van Dyke, whether it's North Sound, whether it's Anegada. In a number of instances, in addition to being serving those communities for the last 100 years, in addition to being the only accredited provider within the Virgin Islands and within the region. In some cases, we are the only provider, period,
In the community.
in that particular community, right? So accreditation says to them is that one facility, that one healthcare facility that you have within your community provides, again, a certain level of quality that you can feel safe walking in our doors and asking us to provide those services, what's not. So again, the signaling effect of accreditation to any particular community in which we have a healthcare facility is tremendous. And not my final, but also a very important audience that we have to look at, and which accreditation hopefully speaks volume to, is our partners. In order for the Health Service Authority to do what it is doing, it needs partners, and our most significant partner is the government of the Virgin Islands. Actually, the mandate to provide public health care is with the government. How they've chosen to do that is actually establishing the Health Service Authority and passing that mandate on to us. And so effectively, we are responsible to them for providing that public health care. And what accreditation is saying to that is that we are providing that public health care service, and we are doing, I don't know if I can use this language, but we're doing a very damn good job at it.
We will take it.
We'll take it.
We're doing a very good job. We're doing a very good job at it. And any, I guess, misinformation, misunderstanding that we don't know what we are doing here at the Health Service Authority should be completely abolished by the recognition receipt of this accreditation certificate. So when I look at the accreditation process and what it says to all of those various audiences, when I enter into my board meetings, those are the subjects that we're talking about. We're talking about patients, we are talking about our employees or team members, as they call them. We are talking about our communities in which we have our facilities, and very importantly, we are talking about our partnership with the government.
Yes. So, and accreditation emphasizes and guarantees to all these audiences what we are committed to here at the BVI Health Services Authority. Dr. Samuel, I'm going to bring you in at this point because I know in line with the strategic objective from the Board of Directors, you have the odious task of initiating and introducing the mandate. And I want you to speak to that from the perspective of accreditation and how that is driving what you're doing administratively across the organization.
Well, thanks, Damien. So, following up in the big shoes of Mr. Potter, I would like to go first from the perspective of the staff. And I go with staff first because we're in the business of delivering health services, right? And in order for us to do that well, we need our staff to be engaged. And the more engaged they are and the more vested they are in what we're doing, then we will have happy patients because they will pass that, they will interact with the patient in a way that says to them, well, we feel valued, we value you, okay, and we want to provide the best care possible to you. So accreditation, in the process of accreditation, one of the things that we have to pay attention to is staff engagement. We have to pay attention to the whole concept around training and education, making sure that staff are engaged. We have a continuous learning organization, not just from the clinical, because usually, when we talk about health services, people think clinical,
Yes.
and they think doctors and nurses, but there's so many other categories of staff that contribute towards the delivery of health services, health care, and they all have to be on that same page, right? Continuous learning, ongoing education, being aware of standards within their fields.
Right.
So, when it comes to the persons who do the cleaning, infection control, they have to be aware of what the standards are around that, as much as the physicians need to be aware of what the standards are around particular disease processes and conditions. So, when we do that, staff feel more engaged, they feel more part of the organization. We help to boost their morale, because for us that's important. And we want to definitely have staff that are committed to what they do and to the organization, right?
And what accreditation does, what I'm interpreting is what accreditation does, it doesn't take for granted that this is available.
Right.
It insists that continuing education and staff improvement is instituted in the organization.
In the organization is made available, and we have the responsibility to ensure that all staff have access to that. So there are processes we've had to put in place within the organization to make sure that staff have access to information.
Right.
Okay, so that is key. And then, when we move from staff out now to our patients, the accreditation speaks to, you heard Mr. Potter talk about quality. And part of quality has to do with the standardization of the care, the care that we are guaranteeing that patients will receive.
Right.
And them knowing that, as Mr. Potter said, no matter where you go in the organization, the standard has to be adhered to.
Right.
And so through that, right, we will build confidence in the community. And that's a big part of, what we are thinking of in the background, trust. The whole thing of trust in healthcare, knowing that patients will feel when they come through the door, they can trust that the care that they're receiving is the best care. Right. They will trust what we say when we give advice, because, in the BVI, there's lots of advice around, right? And you have to be able to stand out, right? And by saying, okay, we function from a place of accreditation, evidence-based approaches to care, and therefore when we say this is what you need to do, that's the place that we're coming from, okay? And so, the community will have more confidence in us, and once the community has confidence, then it means they'll make us their first choice
Right.
at any level, whether it's primary health care or, well, secondary health care, you know,
There is no competition.
there's no competition. So they may need to come here. But certainly for primary health care, we want to be known as the preferred provider
Right.
of healthcare in the
Right.
BVI. And the accreditation helps us to get to that place.
To that place.
Right?
Ms. Williams, let's have Dr. Samuel mention standout. Let's let the community have a better appreciation for the process that is required in order to achieve such certification. And I know as the Director of Quality, your team is part of the driving force behind making sure that not only did we achieve, but remain on track.
Right. So, like Dr. Samuel said, the process is about continuous improvement. So there is a set of standard which starts with our policies and procedures, making sure that we have the things that we say we're going to do in place, and then reaching out to the staff to make sure that they understand the standards. So a lot of it is very new. It's very new to this part of the Caribbean. And so the education behind it is very, very important, very instrumental in making sure, and it cannot be, and Dr. Potter, you said we work 9 to 5 basically, but it cannot be a 9 to 5. So we have to actually make ourselves available to persons who work on shifts, who work, 7 p.m. to 7 a.m. We have to make ourselves available to people who work on the weekends. And so our team is not a 9 to 5 team. Our team is here to give that support and that guidance to persons and reaching every single person in the organization. Because it cannot be that persons who are on vacation, for example, don't get the information that they need to continue to improve. It can't be the person who works on the night or the weekend not getting that information. So there's a lot of education going on in the background for that continuous improvement. I want to also piggyback on what Dr. Samuel said in terms of it being across the board and not just for the clinical people. Right now, we have a few of our infrastructure people who have actually taken courses at the college and have become professional electricians,
Yes.
right? Certified electricians.
Yeah.
So those are the kinds of things that we're talking about. It's not just on the clinical level. Everyone in every capacity and every field have to go a step further. We are no longer at a basic minimum. We have to, step up our game, so to speak.
So to speak, yes.
Right? The standards are really calling on us to make sure that we push a little harder, move a little, if we're at stage 1, we now have to push to get to stage 2. And so that continuous improvement is important.
Right. And obviously, we are now reaping the benefit of all that work because we are seeing where employees have bought into the process improvement, and we're also seeing the evidence of that as well.
Yes.
Because now we can proudly say, knock on wood, or plastic in this case, that the community is getting the care they deserve.
Yes.
Yeah.
Yes.
Mr. Potter, we want to also have an appreciation for, because you did mention partners, and I know that as part of the board's objective, we must also partner with external organizations in order to continue to improve on the level of care. And I know accreditation is part of the driver of this part of your objective. Can you speak to that?
Yeah, thanks again, Damon. Yes. In terms of the Health Service Authority, in order for us to do what we need to do, what we need to get done, again, across the various target audience that I talked about, is that, you effectively need partners. Our greatest partner, like I mentioned, is the government of the Virgin Islands. But the other great partners that we have are the communities in which we serve and the various subsectors in those communities. One of the things that we really need to look at is that we need to refresh all of the clinical facilities that we have around the island. A number of these facilities were built for generations ago, maybe 1 or 2 generations ago. We've modified them as much as we can in order to fit the current needs. But in a number of cases, it demands that we sort of revisit those clinics. So we started that process before I came on, actually, with the Nurse Iris O'Neill clinic in Virgin Gorda. There's still some work that needs to be done on that. And in order to complete that work, in addition to the government, we need partners in those communities to sort of help us in whatever way they can, especially in terms of financing, donation of equipment. If there are medical personnel who want to contribute their time, that's also welcome. But especially for the sister island communities, we need partners to help us maintain that level of accreditation. Because the other thing about accreditation, it's not stagnant, it's not constant. As you environment of continuous improvement, and it needs to be renewed on a regular basis.
Yes.
Because I think our accreditation only lasts for about 3 years.
3 years, yes.
And then again, we have to go through the accreditation process again, which is the application. But part of that process on an annual basis, on a daily basis, or whatever periodic basis, we have to continue doing certain things, and we have to do those things, as you said, across all the various functions within the organization, across all of the various locations in which we operate. We need to do that across all of the various individuals, all the various team members who actually work within the organization, all 650 of them. So no matter whether it's, again, the person who cleans the room or the medical doctor who performs some sort of specialist surgery, again, quality needs to be, again, maintained by whomever is providing that particular service, right? And it needs to be within a facility that actually is conducive towards providing that quality service.
Yes.
In order to get those facilities, I think we need partners to help us towards that journey.
Yeah. And definitely the certification, a DNV certification also says to our current partners and potential partners and partners to be soon that this is our commitment. And if you partner with us, you're partnering with an organization that has already proven that we are committed to providing excellent healthcare in the territory. So your investment is a valid investment in an organization that is proven, tested, tried, and continues to show that we are committed to improve.
Absolutely. And it also says that we're committed to continuous improvement, because that is what we're required to do. We have to look at the data that we gather, because in order to improve, you have to know where you're at.
Yeah.
And we have to look at our metrics or performance metrics across the board and reviewing that data and then acting on the data.
Yes.
That is a part of that's how you get performance.
Right.
And we have to do that on a continuous basis.
Right.
So it also says to, those who want to partner with us, whether it's on facilities, infrastructure, or even in terms of the services and medical services we provide, that we will require of you as well that you take part in this process.
Yes.
Because we can't have us doing it and then you join us, but you're not doing it.
Yes.
Okay, so that there's that requirement. And I don't want us to end before we talk about the fact that since we're doing accreditation, and it requires accreditation across services, so we have a lab. That's not usually the arrangement, but we happen to have a lab as a part of what we provide, and our lab is also required to be an accredited service, and that is a separate process. So we've had to go through that process for the lab. So they are now almost there, but on their way to becoming a certified lab. And when they do, they will be the only certified lab in the BVI.
Only certified lab
Only certified in the BVI and in the United Kingdom's overseas territories.
And in any UK overseas territory.
That's right. So that's the next celebration we're going to be having down
And
here.
I think it's important that we shine light on that, because the BVI community, the board, the government must have an appreciation for the level of work that is being done here at the organization to, one, not only provide quality care, but also put the BVI on the map in
That's
its
right.
own right.
Absolutely.
Right? Because some of the things that are being done here at the BVI Health Services Authority, you're not seeing that in even more developed Caribbean nations.
True.
And that should be applauded, yes?
Of course. Yes, indeed.
Talk to us about the competitive edge, and this is a general question to either guest, the competitive edge of having a DNV certification.
Well, that's me. Oh, I thought that was Mr. Potter.
You can start out, I'll follow up.
Right. So the competitive edge has to do with, we are in a market that is competitive, and we can't overlook that. And when we talk about our partners, the government of the BVI in particular, they're going to want to know that we are able to stand out from the competition, because at the end of the day, financial benefits is a part of what we have to be looking at.
Yeah.
We have to look at how we manage our financial resources, and how we use those financial resources that we have available to us to the best of our ability. And so in having a competitive edge, then it means that we're able to provide services to persons even outside of the BVI,
Right.
because we are accredited, and so insurance companies outside of the BVI would be willing to pay for care. We're a tourism market, and each day the cruise ship is here, we get patients from the cruise ship.
Yes.
So, getting paid for those services that we deliver is key. We're getting into, you've heard Tourist Board talk about, all of the various kinds of tourism activities they want to get into. So as you bring people into your shores,
Yeah.
we want to be sure that when we deliver the care and as we develop other niche services, that external payers will be willing to pay for those services.
Yeah.
And by being accredited, it makes that much easier to attain.
Yeah. And as you mentioned, tourism, I think part of the next celebration or thing that we should highlight is that the BVI HSA did go ahead as we prepare to move into the medical tourism space. We are also a GHA accredited organization, which is a global health tourism accreditation, medical tourism accreditation. They came in, they looked at our system or processes and say, yes, it's fit for our visitors. And we're now a certified GHA accredited facility.
What I would add, Damien, and that's why I went out and let Dr. Samuel go first,
Right.
is that I look at, when we talk about competitive, we usually talk about a comparison between
High Commission.
us, the Health Service Authority, and the private providers. And again, if you compare us in a number of instances, the comparison for us is not going to be favorable. And the reason why I say that is because the Health Service Authority has two mandates. One, to provide public health care, which is effectively a public good, and then also, again, what you could consider the private element of it, right?
Yes.
Or the commercial element of it, right? And because I really want to distinguish in terms of the public health aspect of it, because we don't have any competition in that particular area, right? For the providing a clinic in the sister islands for one of the private providers, that's probably not going to be profitable for them, and they're not going to be in those communities that
Right.
need that health care. So I don't think we could be comparable there or competitive there, because there is no competition
Yeah.
in those particular markets, right? Or some of the services that we do provide, dialysis, I think we're the only dialysis
We are.
provider
Yes.
here. But again, is that profitable for the private providers?
No.
And as such, there's no competition in that particular space. So I really wanted to really point that out, in terms of, providing care to, I guess, the seniors, providing care to the youth, providing care to the indigent. We provide that, to the public. That's a public good. That's part of a mandate in which we don't have any competition, right? And as such, that needs to be recognized, that there's this public good element of what we do, and that needs to be separately appreciated, right?
Yes.
And then we have the commercial element, where effectively we compete against the private providers. And if we're going to stand on a like-for-like basis, when the public is effectively comparing us, when our partners are comparing us, when our patients are comparing us, when our employees are comparing us, it's that commercial element that
Yes.
they need to be comparing,
Yes.
not the public good element. And I think the public good element is always brought into play when we're doing the comparison, which for us is not fair, because, like I said, these are things that we need to do. We have done. That's our mandate that has done for the good of that community, for the betterment of that community.
Yeah.
On the commercial element now, what is saying, if you look at a like-for-like business against the private providers on a commercial basis, what accreditation says is that we are the only provider that provides those commercial services at a level of quality that was awarded an accreditation certificate. That means the services that we provide on a like-for-like basis compared to the private provider is head and shoulders above what they have done. And that's what accreditation, they might argue otherwise. And this isn't, I guess, a forum for bashing the private
No, it's
providers.
not.
This is just a forum just to tell the truth, just to inform the public really in terms of what we have been doing here at the Health Service Authority. I mean, I've only been here for a couple of months, but I felt like I've been here for the last 100 years,
Yes.
for which we've been providing healthcare services. And I really want that to sink in
Yeah.
terms of that. We've been providing healthcare for the last 100 years, started with Cottage Hospital. We are the only, in a number of cases, only healthcare provider in a number of communities. And what that has resulted in, and after all of that, what that has resulted is that on a commercial basis, we are the only healthcare provider that is able to provide the commercial services at an accredited level.
Yes.
That speaks volumes. What's not? What that says is that, I think between Dr. Samuels and Rhonda said the level of investment that we have to make in our people, the level of investment that we have to make in our facilities,
Yes.
the level of investment that we have to make in our services. We do that over and over and over again. One, because we have to, and two, because it's demanded. It's demanded by all of the target audiences that we have, and we've risen to the challenge. We've met that challenge, and we have to continue meeting that challenge.
Yes.
And like I said, accreditation is a 3-year
Cycle.
process. In the next 3 years, again, we have to be accredited for the whole institution. And as Dr. Summers pointed out, we also have to get accredited for a lab. So that's a double accreditation that we've done. So this must speak volumes to whomever is listening. It must speak volumes to, again, whoever's on the other side of what we've been saying is that, look, we not only have we been saying it, we've been demonstrating it, and it's no evidence.
We have the
It
receipts.
is no evidence by the receipt of that accreditation
Yeah.
certificate.
And just to shore up the quality that is embedded within the DNV accreditation, we want folks to have an idea that you can lose it.
Yes.
So
Oh, yes.
speak to us on that.
Oh, yes. So when DNV actually comes every year. That's one of the reasons we decided to go with DNV. They come every year to keep us on target, so that by the time our third year cycle comes around, we're not hit with any surprises like, okay, this we didn't know about and we're not, we're not aware of it. So they come every year, they survey our entire facility, make sure that we're not just fabricating documents and saying, yeah, we have these in place,
this, yes.
right? But they come, they look, and they gave us what they call non-conformities. So you can have NC1, NC2, or they'll give us observations, tell us, okay, you're doing this here, but you can do this better. So every year they come and they give us that information. And every year they come, they tell us we're going to dig a little deeper.
Yes.
Right? So on the first year, they would come, they'll say, okay, do you have all these policies in place? And so, yes, we have all these policies, lovely policies. They tell us, your policies are well written, beautiful, great. The next year they'll come back, okay, are your staff adhering to these policies? And so they go out and they ask the staff, they look at our policies, they read them. Any staff. And they'll ask them, okay, they've read the policy. So let's say, for example, hand washing, they'll observe people, whether or not they wash their hands, whether or not they sanitize. And then they'll come back and they'll tell us, okay, well, most of your staff do, but we noticed that this one and this one, and they give us that feedback. And so now it's for us to then have some education sessions with the staff, go back to we cannot have 10% or 90%, it's 100% or nothing. And so we do all these educations, again, going back to any of the non-conformities that they've cited for us. And we do our re-education, and we just keep it going. So keeping the momentum up every year. And then, of course, the third year cycle, we should be kind of...
And I appreciate that, because what that speaks to me, certainly, is that this quality is being maintained. Yes? Dr. Samuel, Mr. Potter spoke about the fact that we are open to new markets, new partners, just from being an accredited facility. And I think I would love for you to talk more on that in terms of how that can leverage our ability to partner with high-stake healthcare providers across the globe.
Right. So, part of our mandate, given that we have to provide care as a part of the public good, is we have to respond to the public health needs within the country. And so the services that we introduce have to be aligned with what the public health picture looks like. So what are the health conditions in the country that we have challenges with?
Right.
And we have to be able to respond to that. Okay? And of course, all of those services are not going to be on island. Those specialists are not all going to be here. So we have to go out and seek for persons who we can partner with to bring those services to the BVI. And so that is a part of an ongoing work, now that we're post-COVID and we're starting to get back to a certain level of functioning, that is work that we gradually have to do. So looking at who else is providing these services, and doing it at a level that is equivalent to the standard that we want to maintain. And how can we partner and get those persons here? So, persons would know that previously we did work with Hema Health. So
the
now
Atlantic Clinic.
The Atlantic Clinic, right. So we're now looking at other options. We have some specialist teams out of University of the West Indies that we're speaking to. And it's not just a one-way arrangement, because again, when we talk about our staff, so we're also looking at collaborations to have our staff be able to access, training elsewhere, attachments elsewhere. So not just the clinical services, staff development, and looking at how we improve the capacity in the staff.
Precisely. So if you're out there and you're thinking about career building and you want to explore the BVI health landscape as a part of that process, then you may want to consider the BVI Health Services Authority, because if you are working or have worked for an accredited organization, that makes you a more marketable clinician.
Sure.
Apply for your employment with the BVI HSA today. All right. I think we have talked much about DNV and the accreditation, and so I'm going to give each of you an opportunity to wrap up and basically let us know why we are the best.
Okay, starting with Mr. Potter.
Mr. Potter,
Thanks again.
in this case, gentlemen before ladies.
Yes.
Right. So why we are the best? Obviously, if you're the only accredited institution within a particular region, particular country, in a particular industry, it simply says that you are the best. And again, in terms of the various demands on the Health Service Authority, like I said, we are required to provide this public good, which other providers are not required to provide. We have to compete in a very competitive market on the commercial end of things, and in doing that, we sort of compete very well. Again, accreditation is an investment. I mean, obviously, good business is good business to make investments in your business. And so what the accreditation process says is that we have been making those investments. We've been making those investments in our people. We've been making those investments in our facilities. We've been making those investments in our services. And after you do that, and we do it on a continual basis, a consistent basis, and if you continue to do that, then, as I said, the cream rises to the top, and we have risen to the top. That's what accreditation says, that we have risen to the top because we have done the things that are demanded of us. We have done the things that are required of us. We've done the thing that our community requires us to do, that our partners require us to do, that our patients require us to do, that our employees require us to do. And if we have responded, and we responded as well, if we responded, we've gotten the accreditation, not of the whole, just of the whole facility, but we're in the process of getting accreditation for a lab. In a nutshell, that just says that you're the best.
There you go. Rhonda?
Oh, I thought you were going to go with Jennifer.
Okay.
All right. For me, I will actually speak about it from a personal level. I was trained in the United States, and I've worked in the United States. And for me, the quality of care that we have to provide, I've been offering the best of me to the United States. And I decided, no, that should not be the case. Yes, we have some challenges, and I came back home because this is where I want to be. And my mandate is to try to improve healthcare services here at home. So hopefully I'm young enough to be able to offer the best of me to our community, right? We can all get up in a moment notice and move back to the U.S. and all of that great stuff. And yes, the money is lucrative. I'm plugging that in there, because it's not
So it's not all about.
It's not all about money. Yes, this is me. I love home. I love what I do. I'm a nurse by profession, and my what I want to see is better healthcare for us as a community. And I must say, I do not access healthcare anywhere else but the BVI HSA. So I do it for myself, my family, my children. Everybody comes right here for services. So for me, it's just the best, and I want to be here to make sure that we are indeed offering the best.
Okay. So what I would say is, so at the BVI HSA, our mantra has long been only excellence counts.
Absolutely.
And achieving accreditation once and holding on to it for the first 3 years and being now in our second 3-year cycle creates a framework that we can use to ensure that the care that we deliver at every level,
It's
right,
excellent.
is excellent. And it's not just the care, because the healthcare industry is a complex industry, and there are many facets that we have to make sure that we're always traversing and negotiating with. So the accreditation provides for us that guide, right? Because we know then what the standard is, and we are achieving that standard. We intend to continue to achieve that standard. And once we're doing that, I know then that the services and the care that we deliver at the BVI HSA is the best in the country.
Well said. Well, thank you, Ms. Williams, Director of Quality, Dr. Samuel, our Interim Chief Executive Officer and Chair of the Board of BVI Health Services Authority, Mr. Potter, for coming on the program and talking to us about our great achievement of our DNV accreditation, and also explaining to the BVI community why we should be your preferred provider of care in the Virgin Islands. It was a pleasure talking to each of you.
Thank you for having us.
Thank you very much, Jamie, for having us.
Thank you. And I know this program is lengthier than usual, but this is Health Watch, where we focus on all things healthcare and where we keep you informed on the best place to access care throughout the territory. I'm Damian Grange. It was a pleasure being here with you, and I hope you would have learned something about the organization that will put us as your preferred provider going forward. Have a great one.